Hello, everybody. Great to have you aboard this webinar. I'll just allow a few minutes or so for extra people to join in. But firstly, thank you for joining us. I hope wherever you are, the sun is shining upon you as it is for me. It's in this welcome spring morning, which is a lovely start to the day. A few bits of just obligatory housekeeping. Firstly, by way of introduction, my name's John. I'm one of the key account managers at Posturite. Just to let you know, the webinar is being recorded, so it will be viewable back on our website shortly. All slides are going to be sent out to you for all those who have registered for this webinar following the completion of the webinar, certainly within the next 24 hours. One point, if you have any questions throughout the webinar that you would like us to tackle at the end of the webinar, there will be time for this. Please put this in the Q&A section rather than the chat function. If it does go in the chat function, we won't be able to see it, but in the Q&A section, we will be able to take your questions. We also want this webinar to be as interactive as possible. So we're running a poll throughout the webinar. You will see that. So please feel free to answer that. And again, at the end of the webinar, we will be discussing your views. And on that, thank you very much for anybody who's on this webinar, who's actually provided some of the content for this webinar. It's an interesting one for us today because actually the content of the webinar has come from you. What we're going to look to be doing is discussing your views, your opinions, your challenges as we put our heads together to discuss those views. So thank you very much for that. And if you haven't subscribed for our mailing list and our webinars, please feel free to. We like to keep you updated with as much information as possible and definitely around future webinars. Our next webinar will be coming in June, and I can tell you it will be around X-ray glasses, which if you haven't seen is an incredibly innovative bit of technology, so certainly one not to be missed. But I think that allows enough time for everybody to join. So what we will look to do is dive into the content of the webinar now. So if we can just go on to the next slide. Here, by ways of introduction, for anybody who doesn't know us at Posturite, we are here really looking to help people improve their health and well-being in the workplace. And something that we pride ourselves on at Posturite is really our people-centered approach. So firstly, you can see our MD, Chris Jones, in the top left-hand corner there. And speaking of health, well-being, Chris is currently in training as part of the Posturite team that will be cycling the length of the country in order to support our supported charity, the Stroke Association. You can see Katharine there as well, who many of you will be familiar with, but Katharine is our lead consultant and will be joining us on this webinar. We also have our team of nationwide assessors, and perhaps where Posturite are best known is around helping people with their musculoskeletal issues and being a largest provider of ergonomic provisions in the country. So you can see some of our assessors there. We also have our managed service division, which is where we're supporting clients with any of the administration around their online systems and making sure that we're helping to support them in any way we can around that. And finally, our enablement division. And this is really helping with neurodiversity, disability within the workplace. You can see Andy Rigby there, head of that division in the middle bottom picture. So that's enough about Posturite, and let's look to dive into some of the content of this webinar. So firstly, I'll look to scoot quite quickly through these slides, but just to give you some example of where the data has come from. So here you can see that our results were nicely split up between the public and private sector. So this was something that was pleasing for us, that the data has come from a variety of sources. And just on to the next slide, please. And again, really just to show the validity of the results that we're going to go through is that we've got a nice spread throughout organisation sizes. So no matter where you're joining us from to today, in terms of the size of the organisation, we feel that the results that we're going to go on to discuss now, we have a nice fair reflection right the way across our client base. And on to the next slide, please.
Yes, I think actually I want to put some comments on this one. So, this is the question about whether companies are offering hybrid working. And I think this is fantastic to see that nearly everybody is offering hybrid working of some sort. I mean, I've been working in a very flexible style for the last 2 decades. In fact, probably a bit more than that. But and I think the opportunity it creates for movement, inclusion, productivity, life, I think is huge. However, the speedy application of hybrid working, I think, has created a few bumps along the road. And I think we really need to sort of stop and look at the benefits we could get from working in different places. Look at what tasks we do, where they should best be performed, and not try and just adopt general principles for everybody. I know a lot of companies have said, oh, everybody can work, 2 days at home and 3 days in the office. But surely most employees have very different range of tasks. And I'd like us to put a little bit more thought in this, just to really try and get the best for everybody. And so I think this slide is fantastic, but I think it is the start of getting more work done. Yes, so let's have the next slide. Now, as I was saying, I think there's a few bumps along the road, and we all know that it's important that we make sure that people are set up correctly. And it's good to see that that people are assessing people both at home and in the office. And I'm really not surprised that people are using online assessment tools. For me, that allows us to get to the people who need our help most the quickest and put our resources in the right place. And I think it is ideal for home situations, because you don't have the problems about travel or about access to the home. So I think this is a very reassuring slide in many ways, to show that people are doing this. I mean, John, from your experience, why wouldn't people use an online system, do you think?
I mean, it's a good question. I think there's certainly, when I discuss with people around potential negatives around online systems, a few common themes that may come up. I mean, I think firstly, people often like the face-to-face approach and see the validity around a face-to-face approach, which I think at Posturite we certainly agree with. However, what I think that ultimately we like around the online approach is it almost allows us to cast a net over the majority of people and perhaps bring to the surface the people that can really then get the greatest benefit from our face-to-face time. So rather than actually trying to split our time evenly amongst the masses, if you like, it allows us to potentially assess and bring to the front the people that perhaps will get the greatest benefit from most of our time. But that's certainly one thing that comes up. I think another thing, mentioning the word time, is that people perhaps feel that it's going to create additional time or additional workloads. But again, we think now that the systems can be really well set up in order to minimize the amount of time they take. And we also are now looking to provide additional services to support clients with that. I mentioned at the start our managed service. And then understandably, one thing that would come up as well is around cost. The people understand that there's an additional cost involved to these systems. But again, I think that when you break the cost down per head, and particularly now in the hybrid environment where we can utilize it in both the office and home, actually it can be deemed quite a cost-effective way of doing things compared to the time that perhaps other methods would take. But I would say they would be the main three things, Katharine.
Okay. Tony, do you use an online tool, or what are your views on that?
Yeah, we use an online tool, and I also, I suppose, one reflection that I find interesting is if someone will have an employee who works in the office all the time, and they're like, so if they've done an assessment, maybe they want somebody to come and physically have a look and check things out for them. But if they also do hybrid working, which pretty much all of our employees do, they never ask you to go out to the home because they don't want you there. They'll accept a Zoom call, and they'll, or whatever, we use Teams, but they accept that virtual is a way to go to look. So yeah, I think it's, I suppose for me, it is kind of multifaceted. If it is as an employer, you can do that, having the support to, yes, use that online tool. And then if there's any other kind of things that fall from that, then having them there is really valuable.
Oh, that's great. Excellent. Tom, could we go on to the next slide, please? So this is all about reviewing and following up, when we've used a tool or perhaps just done basic assessments, and when further assistance is needed. I think this is really good to see, nearly 75% use in-house resources to do a follow-up. I think that's great. I think, that spreads the awareness of DSE throughout the system. And then you've also got people always on hand to provide support. And what I'd like to say is, I'd like to think that people use our online support tools that we have on our website, some of our infographics, and also our DSE advice team. So we're here to support these in-house assessors. I thought it was quite interesting, though, that we got 20% who thought it wasn't applicable. Now, that's a little bit of a worry, because, assessments, there's always people who need little bits of advice and help and setup. So I was a little unsure whether that was just because people weren't using an online tool. But I say my main message is that's great. Good to see in-house people getting involved. And please, if we can do any more to help, any more resources, let us know. So really, can we go on to the next slide, please?
I think this is probably one for me to answer, just in the sense that it's a question I get asked a lot. What do we think will, in terms of assessment, what percentage of people can we expect to get further actions? Now, the answer that I've always given is around 5 to 10%. That's what historically at Posturite, perhaps working from things like online systems, we've seen as an expectation. And I suppose around half of the data that we collected in this survey supported that it's within that 0 to 10% bracket. But perhaps, I suppose, interestingly, we've seen quite a sizable chunk at 22.2% there that have predicted to be 10 to 20%. So that's perhaps one of the surprises that we took from some of the data that we received. Katharine, Tony, I don't know if you'd have any thoughts around where this increase in further actions percentage has come from.
Personally, I think it's hybrid working. So we've got people that let's be honest, COVID was only ever going to last 3 weeks. Yeah, right. But and then lots of people didn't buy equipment, and then they did, and then it's taken ages. And some didn't want it in the homes, which is difficult. I can't really say fine, because you need them to work in a legally compliant way. So yeah, I think that's driven the increase hybrid working.
Yeah, and I think that was very interesting with those figures in the news. Was it yesterday or the day before yesterday, about the increase in the number of people who are, feel that they are unable to work due to ill health, and the rise in musculoskeletal. And there was definitely a narrative going through some of those media outlets saying that they thought working from home during COVID was maybe a reason for that, because people weren't set up well. I don't think there was any sort of valid research behind that, but it was interesting that was a comment. And I certainly saw that during lockdown, and I certainly still see people working at home with some really quite poor situations for the tasks that they are doing. And I'm afraid I'm going to be a bit like a broken record on this, in the fact that I think we have to consider what people are doing at home to be able to decide what their workstation setup should be. Because we can't blanket assume that everybody does the same tasks. What sort of setup you need if you're doing telephone calls and Zoom calls will be completely different from if you're doing a lot of data entry at home, and the setups will need to be different for those situations. So yes, I think that let's go on to the next slide. So who do the majority of the issues get referred to? And again, I think my soapbox is going to come out a little bit here. As a health and safety professional, I wasn't surprised that 60% go to health and safety. However, I was disappointed. I mean, surely DSE, we've had the regulations for 30 years. It should be a little bit like setting up, to drive a car. It should be a little bit of second nature. And it should really be done sort of within the in-house team. Health and safety is more about building the policies and supporting and finding the ways so something works, not be that direct referral. So I would have expected a more managerial first intervention. Tony, I'm sure you have a view on this too. So what do you think?
Yeah, and I think I kind of almost fully understand those stats, and that even the ones that would go to their line manager, who if you don't do something day in day out, you tend to want to reach out to other people. It's like absence management or disciplinary, everyone goes, well, talk to HR, and then kind of blames them for everything. So I think it's probably fallen into that bracket, really, hasn't it? So I, as your leader, not really sure. Let's push it over to health and safety.
I think there is often a little bit of a fear factor, isn't there, to taking some responsibility and taking some action, whereas actually, if you ask somebody else, as you say, it's not your responsibility. So I think, yes, I think that is something that we do see, isn't it?
Yeah.
Yeah. Okay, let's move on to the next slide. Now, this one, how many management hours would you estimate on average to resolve a DSE problem? Oh, I was quite shocked by the figures here. I can only think that people have answered this question on the more significant DSE related issues, because in my experience, so many of the issues around using computers are relatively minor. There could be things on chair setup or placement of keyboards or something like that. And I cannot believe that things would take an hour to resolve. But with the more complicated ones, I think that could be the case. And so I think it may be a bit of a limitation of the question here, in the fact that, yes, complicated issues can take a while, particularly if you refer them to occupational health, or if you have to do a face-to-face visit at home. Of course, it's going to take a period of time. But I would like to think that most comments or problems related to DSE could be resolved relatively quickly. Let's move on to the next slide, I think.
This is probably one for me to pick up on in terms of things that I'm talking about with clients at the moment. And it's really around whether clients are providing standard home working furniture for their employees. This answer probably came as no surprise to me. I think actually, if I would have predicted, it would have been about a 50-50 split. I think in truth, over time, it's probably the yes section will increase. I think that we're currently spending a lot of time working with clients around their procedures on supplying home working equipment. We often put together for clients things that we internally term a lorry, a list of recommended items, a bespoke catalogue, if you like. I think we mentioned the pandemic earlier. I think in the early stages, there was the panic around that and making sure that people could work from home. I think now we find ourselves in this hybrid model that certainly seems to be here to stay. As we saw earlier, the vast majority of people are working in this manner. And now I think comes the time to make sure that we're setting up our employees in the right way. And I think that many people are now moving towards setting up these standard processes, these standard catalogues. So whilst I know that many still perhaps don't provide standard equipment for people at home because things are available in the office, as the results show, the 50-50 split doesn't surprise me. And I expect that to continue to grow in the yes section. If we can have the next slide, please. And I think if I sort of mention this one as well, because really it's around perhaps the monetary value that we're assigning to an employee in their home workstation. Again, these results didn't surprise me. When the pandemic initially began, many of my clients did things like provide an allocation of money for their employees to use. Often the figure of around £250 was mentioned. So again, that wasn't something that surprises me as being the majority vote there in terms of the amount of money that was applied. What I think we have seen, perhaps as a result of that, though, is people buying perhaps unsuitable equipment if they were given their own decisions, perhaps even non-DSE compliant equipment. And I noticed from some of the results, that's one of the challenges that was mentioned for people, that they're now dealing with people selecting their own equipment that is now perhaps breaking or actually deemed unsuitable. So what I expect to happen is I think that we might start to spend perhaps a little bit more money on the home workstation. Now we know our current working situation is perhaps here to stay. But in terms of what we are providing around the lorries that I mentioned, certainly those figures of around £250 to £500 covering the vast majority is things that we're working with clients on. One thing I do always mention at this point when I'm speaking to clients, though, is that actually I think we always need to do a needs analysis rather than just providing a set figure per person, because it might be that some people have varying current setups already. So, for example, one employee might have a desk and a screen available to them and perhaps just require a chair, whereas other individuals might need more items. So rather than just placing a monetary value as a total package, I think it's always important to make sure that we're spending that in the best way that we can as well. And if we can move on to the next slide, please. Okay. So in terms of this, then I think this is something that again, doesn't surprise us. I think it's something that, again, not to repeat myself, but the answer might grow around the yes, because what we are finding now more and more is that people are looking to replicate those workstation findings at home and in the office. Once people tend to find a solution to resolve any musculoskeletal issues and work both comfortably and productively, we understand that it makes sense to mirror those things. And so that's things that, again, we're working with a lot of our clients on. So it didn't surprise us to see that the vast majority of people said yes. And in fact, we predict that that might still grow. This might be one I've been speaking for a while there. If I hand over to yourself, Tony, is that something as well that you think has been a fair representation of the things I've said from your perspective?
Yeah, and I suppose, I mean, reflecting on maybe even a few of the slides, so it is all about the person. So we've got some people who need, because of the way they work, you know, 2 monitors and a bunch of kit, where we've got someone who can work off something very different. Equally, we've got some people with different sized homes, which I think has been a challenge. So certainly for us, we've made sure that you have an availability of different sized desks. I mean, the quick answer to this is yes, we do provide reasonable adjustments, but then equally, I would also reflect that if the person's in the office 4 days a week and then working from home 1 day a week, you could actually reflect on whether or not they do need some of the equipment. So kind of some of the more expensive equipment, I'll pick on a chair because obviously they tend to have a high price tag. Do they need that, or can they have a kind of a lower price chair rather than replicating the 100% exact same? So I think for me, it very much has to be, let's go back to what, you know, what's the individual, what's the role. You spend different money on different people. I suppose that's equity, not equality. And to basically, to, you know, support your employee in the best way you can.
Tom, can we have the next slide, please? So this is talking about whether people are concerned about their people at home and the negative effect on their health. I think actually I was fairly unsurprised by this. Certainly in my experience, you know, quite a large number. I mean, I think a good third of the companies I work with have really got the policies and procedures and the assessment and the feedback loops in place. So I wasn't surprised. But also, I think, you know, I would be concerned if I didn't feel that I had these processes in place. I think I would be concerned about people's health at home, you know, particularly, you know, in light of the figures that are being bandied around. So I think this is a fairly standard type response that we were expecting. So can we have the next slide? Now, this is a very interesting one. Is your organization attracting staff back into the office? I mean, I'm really pleased to see this. As I've said earlier, I mean, I love hybrid working. I love working at home, and I adore coming into the office too, you know, for different reasons. And I choose to do different activities in different places. But I do think, again, I'm back to my soapbox of we need to think about what tasks we're doing and where we're doing it there rather than making blanket decisions. So I think it's good that we're looking to encourage people back, but I'm hoping we're encouraging people back to do the right sort of tasks, not just because we want them back. It was interesting hearing Jeremy Hunt yesterday saying that he thought that there should be a default position of going back to the office. And I think it's a little bit of a single statement and doesn't look into the nuances behind to get the best for people and the best for companies out. So Tony, I'm sure you've got some thoughts on this.
Yeah, definitely. And I suppose my first reflection is certainly as an organization, we aren't encouraging people back into the office, but we're also not encouraging them to not come into the office either. Well, what we're trying to do is, and equally, I'm seeing the office space evolve. in the very much we've got more collaborative workspaces than we've ever had, and for me, and you know, I love doing stuff like this because, you know, we're all in several different places, but if we wanted a meeting to discuss something and talk about something, the richest experience you can have in terms of content and sharing ideas is physical. You know, it's all getting together and having those kind of conversations. So yeah, I'm not surprised. I think in ways I was, because it kind of like 60% of people try and rush back and just go back to an old way when they presume that the current method isn't working. But yeah, I mean, for me, I'm fascinated by the evolution of the workplace that certainly I'm seeing in my organisation.
Yeah, I think that's great. So I think the next slide is actually looking at the poll that was been running in the background. So I think, John, over to you with that one.
Yep, I believe so. And I think we also had some challenges when we looked through to all those. Again, thank you for completing the survey. What I looked to do is go through some of the most common themes of challenges that were mentioned. So perhaps if that's okay, I will put some of these to the panel, and we will provide our thoughts. I mean, one that certainly seems to come up and has been mentioned early in the webinar is really this thing around unsuitable equipment. And you can see actually there on that side, the big word equipment there. And employees ordering unsuitable equipment and perhaps from buying outside of the processes. I mean, firstly, as I say, for me, working with lots of clients at the moment about making sure that their processes are correct for home working equipment, you know, ensuring that things that they're buying offer, firstly, compliancy, but also warranty periods, that they're the most cost effective as well. So really, I would encourage all organizations to feel free to reach out to us to explain how we do this and how we make the ease of ordering both for home and the office. But to the rest of the panel, I don't know if you have any thoughts around the ordering of unsuitable equipment and how as a process we can put in place to make sure that all of the employees are getting the best things available to them.
It's probably the most appropriate for me to answer that, because I don't work for you, and you know, one of many suppliers who I could decide to use. What I always say to all leaders when they and or employees when they come and go, and whilst I hate to quote a company, it's usually can I just buy something on Amazon? And my answer is always, you can. It'll be rubbish. It'll last 12 months, and then you'll buy something else. So, you know, talk to your leader about the fact that they're going to pay for it twice. And also you might be coming back to me because the thing you bought is rubbish and doesn't actually do what you think it did, what you wanted it to do. So for me, choosing the right equipment and having a process where you do control the equipment that people buy just makes more sense. In the end, it saves your organization money.
In terms of themes that came up, it'd be interesting to get your views on is around the online systems as well. One of the challenges that seem to come up a few times is how do you actually manage getting people to complete, even if they've been invited to do it, and whether there are any particular methods that you have in place to increase the amount of people that are completing an online DSE assessment. Again, Tony, I don't know if you have any thoughts around that, and I can mention some as well.
Yeah, I mean, for me, I've done a few different things. So, you know, like, it's linked into our mandatory learning, which if you don't do, you kind of, your leader gives you a bit of I was going to say a clip there, but, you know, in a non-violent way and in a non-aggressive way. The winner, though, more than anything was, so we provide free eyesight tests only if you've completed a DSE assessment. So if you make it worth the while, they're even more interested in doing it.
Yeah, it's really interesting. It's sports. You mentioned the word leader and things. I always find my recommendation is the sort of the buy-in that you can get from the top of the organization is always helpful, and perhaps the things like the reminders that go out, if they can then ultimately become perhaps a bit stronger in their wording and perhaps have more senior sign-off, we tend to find that does increase the rate. And it was also asked what our perception was around a good rate of completion, or what would be good and what would be excellent. Katharine, I don't know, again, if you have any views on that one.
Oh, not really. I mean, obviously, excellent would be everybody. I mean, it is a legal requirement, but it is difficult. As a physio, it's difficult to get people to continue to do their exercises when they're no longer in pain. If you're not hurting, it goes down your priority list. We were all really, really busy people. And I know I'm sort of skirting around the answer on this one, but I think what is so important is making sure that everybody knows what to do as soon as they have a concern. And we should be able to do that without judgment. Oh, you haven't filled in or anything else, because the whole purpose is to prevent problems. So, I would like to focus on making sure people have the information and not worrying. Yes, we need to nudge them. We need to make sure the information is available. We need to make it accessible, but we need to focus on making sure that people have the support they need to set themselves up correctly and know what to do if there's a problem. So I know it's sort of round the way and not really answering your question. I suppose to answer it, excellent would be 100%.
That's great.
And I would jump in there and say, so it's certainly in my organisation, we've disconnected the information that goes with having a good DSE setup and the DSE requirements, so that you've got both. So they're not disjointed, they're just you have both. And at the risk of being quoted, the reality is, especially if you run an online system, for me, I always say 90% is 100%, because you've got sickness absence, maternity and paternity leave. So you're always going to have an amount of people that haven't completed it because actually they're not even in work. And then on top of that, you've then got the people that are being delayed and completing it. So I mean, I suppose for me, 90% is 100%.
Good point. So yeah, thank you very much for those views and those challenges. I mean, one, just briefly before we move on to the Q&A, I quite like that somebody just mentioned time, which I think is probably a challenge that applies to us all. So again, I mean, to answer that point, just a reminder that what we look to do is to support our clients in any way we can. And one of our sort of huge growth in services that we provide is around our managed service. So really looking to be an extension to a client's in-house team in supporting them with their DSE needs. So if that is something that you ever need support with, please do feel free to reach out. But I think it's probably best for us to move on to the Q&A section at the moment, because we really wanted this webinar to be as inclusive to all of you watching. Hence, we've been discussing that data, but we've had some questions come through. So if I look to put some of these to the panel for their opinion, that would be fantastic. Let's have a look. So we've had one come through here, just mention about whether Posturite offer a DSE online assessment training tool, like previously, that's missed. So the tool WorkRite that was built by us is very much still available, and we work closely with the provider around that. So if anybody is looking for online DSE assessment tools, please do feel free to reach out to us, as we can happily still support you with that one. It was then asked if we provide equipment for use at home. How is this managed? Putting together desk inspections and maintenance on an ongoing basis. So perhaps if I'm you're totally there, be interesting to hear when you're providing equipment for home, do you have any processes to manage that and to stay on top of maintenance and things?
Not so employees can request new equipment if it's faulty. We don't particularly do maintenance. Obviously, I mean, the desks last effectively however long they last, and we would say to employees, inspect your inspect your workspace. It's I've never been asked that question before, actually, on desk. I've often been asked it on PAT testing, because that's a very interesting one. And on the legal side, From a PAT perspective, you can just ask your employees to inspect plugs, cables, and report anything that's faulty to get it replaced. So yeah, it's I suppose it's employee led, if that makes sense.
I think probably as we go forwards, that may become part of almost like sort of an annual assessment or something like that. These inspections, I think we'll probably, get ourselves in a role, and that will be just part of being a mobile worker. You take that responsibility to do those visual and common sense inspections. That's what I suspect anyway. That's what I would ask our teams to do.
And I suppose it supports the earlier point, Tony, that you made about making sure that the quality of product that you're buying at first instance is right. You mentioned about, buying cheap and then having to buy twice. So making sure I would always encourage any client to look up things like warranty periods to make sure that you can get the length out of any product, which would obviously help with the maintenance. An interesting one here, a question is it realistic to supply every employee with a full office equipment setup? Also would be interested to know how other companies manage when staff leave the organization, which again, I think is an interesting point that I often get asked. I don't know, Katharine, did you want to take that one, and Tony?
Well, I would come back to, what does a full office setup mean? Because I come back to depends what the task people are doing. If you are doing a lot of desk-based work, keyboard and mouse, then yes, you are going to have a good setup if you're doing it for prolonged periods of time. If, however, when you are at home, you are doing research and reading documents and writing notes and doing Zoom calls, you may need less of a vigorous type setup. And in fact, I would encourage people to use, to sit on their sofa and make a few calls occasionally. Body likes a bit of change of posture. So, so I think there is a difference about full office. But if somebody is working for prolonged periods of time and they are doing a lot of inputting, then they will be their risk will go up, and therefore to control that risk, you need to provide them with an environment in which that they can work without the risks of developing, musculoskeletal problems or other problems. So, I think it is feasible. If we think how much money we spend on office space and office equipment, if we're not doing that anymore, then maybe we could divert that if we're getting people to work from home. It's going to be different in every case. Sorry, Tony.
And very much that is what my organisation does. So, and we don't have a minimum or maximum spec. It's about what do you do for the role and what do you need. Because I talk to some colleagues who were computer gamers, and they've got like a fancy rig, as they often refer to it as, that they can literally just plug their laptop in, and it's like wall-to-wall monitors with light up keyboards and all sorts, and they decide to use that because it works for them. And then we've got other colleagues who maybe are living with so we operate call centres. So let's say a younger worker lives with the parents still, has maybe setting up a workstation in their bedroom, so they want a pop-up desk. Yes, we do kind of insist on a chair, because you can't be comfortable without it. But actually, that pop-up desk, because it's small, they'll be using a keyboard, mouse, and a laptop stand, and they'll be using the laptop as a monitor. And then, other employees who we provide 2 monitors for. So that's where I'm just trying to paint a bunch of different pictures there. But I also, in terms of the question, it almost did as well sound like, so when employees are leaving, what do you do then? So all the IT kit, we definitely 100% get back. And keyboards, mice, yeah, we get that back because there's somewhere we can put them, and then we can reuse them. The reality is that unless you've got kind of works vans where you can get somebody to go and pick them up, currying a desk and a chair back into an office to then need to have space to store it is expensive. It's easier to just write that off as effectively as a loss.
It's great. I just wanted to say thank you to everybody, because there's lots of questions coming in. So I'm just trying to summarize some of the common themes here. But one of the things that seems to be come up is providing people equipment who then don't want to use it and actually work in a non-compliant way, and what our thinkings are around that. So if we're supplying equipment for somebody at home that they then choose not to use, would either of you have a view on that one, as that seems to be a common theme in the questions?
It doesn't surprise me. I mean, we've had this problem, and I think that comes back a little bit to what I was saying earlier. You know, if it doesn't hurt, why do people bother? We've all got bucket loads of things in our lives, and what do we focus on? I think we need to nudge. I think we need to remind people as to the aches and pains that can come from that. We have a duty as managers. If we were seeing somebody working on a building site without a hard hat, we would say something. So if we're seeing somebody constantly hunched over a laptop, I hope that the manager would go, do you know, that's not great. Do you find your neck hurts? I mean, it's not clever stuff, this. Sometimes we'll say that about people lifting and handling badly at home, or I do, maybe it's just me. But, you sometimes go, oh, really? Do you want to do that? So I think we need to nudge people. I think we have to be realistic about, is it perfect or is it just off? If it's just off, it's probably okay. But if it's a poor situation and putting at risk, I think we have a duty to constantly remind people that this is not what we expect and it's not good for their futures. Tony, have you got another view on that?
Yeah, and I think that's fair. I mean, on one hand, I often say the words "I'm not your mum," but then equally, my view in terms of this is it's information and inspiration. Because picking up on your point, so leaders, I don't think anybody's employed now to be like a manager all the time. They've got a job, and then they've also got people that they have to manage. So because of that, they can be a little numb in terms of not noticing things like that. So just some kind of campaigns so that you're informing and inspiring. I saw an email from yourselves just the other day about eye health that kind of made me think, you know what, it's been ages since I've done anything on that. And as a reminder, you know what, I'm going to push that out to or different sites or different, like a variety of different stakeholders and communication means to kind of scattergun that message out as wide as possible. So yeah, I think sometimes it gets overlooked accidentally, but if you can inform and inspire and keep it, maybe so I do a well-being campaign where we everything from mental health to nutrition, etc. And I always throw ergonomics in there as well, and I always try and make it so it's something different every year, so you constantly, but hopefully you have to do it so it's quick, because people will say they haven't got time, and you've got to do it so it catches their eye. So just try and do that, so that then people will go, actually, every time I talk to you, you're hunched over a laptop. Is your setup okay? Or even the person themselves going, this isn't, like, I can ask for this stuff, and why don't I?
Actually, one of the best things I always find is actually that people are much more interested in looking after their children. And there's a lot of things about children's posture and everything else, and actually just reminding them about looking after their children often reminds them to look after themselves. But it is all about nudging. But things are getting better when you get as old as myself. You do look back and you go, gosh, we have come a long way. So it is always easy to focus on the negative, but the number of, I walk into office environments, not so much in people's homes, and I do see people using external monitors and setting up much more than I used to. So, I think we are moving in the right direction, but it's up for all of us just to keep nudging and helping people making better decisions for themselves, really.
Thank you. Again, in terms of common themes, one of the things that seems to come up is around the word legal and legal requirements. So somebody's asked what legal requirement under the Health and Safety at Work Act is there to promote or to provide, home working equipment? And that question is mentioned a couple of times. I don't know if you have any views on this, panel.
Well, I mean, as we know, the Health and Safety at Work Act is not very prescriptive. So you're never going to see things about, you must provide home working equipment. But we have the duty of care. And, we are required to do risk assessments. And where there are risks, we need to do something about them. So there is your legal requirement right there. If you identify there is a risk, you need to do something about it. And if the thing you need to do about it is equipment, then you need to do that, but it may not always be. So it's not, again, not back to blanketing everyone together. Tony, you're probably better on the law than I am these days.
Yes. As somebody that obviously, does do that a lot. So I suppose I always like to think of where that question. Someone asks me a question, I like to think where does it come from. So, are you going to get prosecuted if you don't do any of this? No, realistically, the HSE is out there looking at construction sites. Are your employees going to be less productive and more likely to leave your organisation if you don't give them the right kit? Well, yeah, they are, because they'll go to somewhere else, because that interaction for them, especially as a hybrid worker, they are going, my company doesn't even care enough about me that they provided me with the way in which I need to work. So I think that's a massive issue in terms of recruitment and retention. So the law would be around if you'd be a DSE user if roughly 25% of your working day was using electronic equipment without having the regs directly in front of me. So you ask yourself that for 25% of their day, are they sitting in front of a computer? And then if they are, what do we have to do? The regs are massively out of date. If it is also that you're asking what's the minimum that I can do, give them a chair. They can work off the dining room table or whatever, but like, you definitely need an office chair. You definitely need an external keyboard and mouse, and you definitely need a laptop stand so they can use a laptop as a monitor. So that, like, I'm just trying to answer what I think is maybe the background of that question.
I think the other thing is, if you go onto the HSE website, they have changed and updated their guidance since the emergency sort of COVID thing. And it is very much leaning towards that situation. If somebody's a user, you need to provide equipment. But I would suggest that you go and look at the HSE website. If you don't know where to look, give us a shout and we'll pop it in with the recording of this, just to where that link is, just so you can go and look at it for yourself.
One of the other common themes that's come up is around hot desking. And somebody's asked, what is the best approach to managing DSE in hot desking offices? We provide mandatory online training to personnel, but problems arise when someone requires individual equipment or with ensuring colleagues assess and adjust a workstation each time they set up at a new desk.
One of the things I hate the most is when I walk into an office and somebody has sellotaped a piece of A4 paper that says, this is my chair, don't adjust it. So granted, there will be some people that require ergonomic equipment. If it is that you can provide storage on site so that they can put it in there to like kind of pack it away of an evening because things go missing. Not that I use a stapler anymore, but like, you could have never left one of those on your desk at one point. So and ergonomic equipment is no different, especially if it looks fancy. But the best way of being able to ensure hot desking environment is to have an environment in which you can hot desk. Sorry, that sounds stupid, but and this massively expensive, I suppose, on one hand, but all your desks adjust, all your chairs are high spec, keyboard, mouse, monitors that are on arms so that you can move them. Yes, then on top of that, that person might need a ergonomic mouse or keyboard, but that's when you go, is there somewhere we can use as storage, like a locker that we can give them to put it in, so that they can take that with them wherever.
Yeah, I mean, I think, for me, it's, make it adjustable, make it easy. And when you first introduce people to the hot desking, make sure you have the support there so people know how they can quickly adjust the chair, adjust the workstation. I mean, I've timed myself doing this, and I can set up my workstation in under a minute. and it's a good investment, but you've got to know how to do it. So when you first introduce people back to the shared desk, make sure they understand how they can quickly and effectively adjust their workstation to their needs. And that would be my suggestion. Invest in good, flexible, easy equipment and bit of training, and your job will be a lot easier, in my opinion.
And I mean, you mentioned desking. There's been a couple of questions around desking. So if I combine those to be essentially one question to get your views, but the question asks, if an employee asks for we have to provide it. And then someone's also asked about our recommendations or ideas around work benches over standard desks.
Okay, I mean, if somebody asks for a sit-stand desk, do you have to provide it? Well, it depends why they're asking. But I also come back a little bit to Tony's point, is if somebody is uncomfortable, why wouldn't you? Because otherwise they'll be looking for somebody else, somewhere else to work. If you're not supporting them, they're going to go elsewhere. But equally well, we will have budgets to live within. How often are they standing there? Just finding out a bit more about it. Equally well, we've provided sit-stand desks and platforms places, and then go back and find they're not being used, and that's a waste of resources. So I think a good conversation with the individual and finding out why they feel they need it will probably give you the answer that you need. But as far as I'm aware, it is not mandatory to give everybody just what they ask for. I think you can have a conversation and understand the reasons before making a decision.
Right.
You were asking about bench desking as well.
Yes, there was a question around our views around bench desking compared to standard desking.
If by bench desking we mean something that's sort of screwed in place and screwed against the wall, I would say I'd be very wary, because it provides you with a lack of flexibility. That would be my general view, if that's the question.
Yeah, I think sometimes around bench desking as well, it's where we can have multiple desks that we then lose the ability to adjust someone's individual desk as well. So I think, again, the theme that we've been discussing is really to be able to provide that flexibility for change is something that we would always encourage. And as a result, perhaps that does go against bench desking. Certain solutions are available. For example, we have provided things like platform desks, sit-stand platform desks to go on to bench desking if you're concerned about not having the flexibility as a result of having bench desking. But I think that would be our views. I think perhaps if we finish with one question, because it's an interesting one. I think it perhaps comes down to an ask of an interpretation. But somebody's asked, is there a difference between staff asking to work at home and staff being asked to work at home? So I thought that might be an interesting one to conclude our Q&A.
That is an interesting one from as well as being a health and safety practitioner, I'm also a HR practitioner. So that literally comes down to contractually, where does it say their workplace is? So if it says their workplace is X location, and then you ask them to work from home, contractually, what do you do now? And this would also go as well, kind of unionized v non-unionized workplaces, because maybe you'd be in a position where you definitely have to provide them with some kit that they can work from. Like I said, you can do those basics that I mentioned, and flexibility, and treating each role as a role. And that's the beauty of risk assessment, because that doesn't set a precedent. But you would also, as an organisation, need to say, what does that mean in terms of, am I going to provide contributions towards their Wi-Fi bills, the gas and electric bills, etc. You don't have to, but as an organisation, you would need to certainly reflect on that as a policy. A lot of organisations use the argument that you don't have to travel into work, but if you are going to, and I'm once again, I always try and think of what the background is. It would be difficult if you used to have an office and that was their contractual place of work, and you were deciding to shut that office down and tell them they have to work from home. I'd be phoning a lawyer, to be honest, because that is a tricky one.
I think we've had a question like this at one of our seminars in the past, actually before COVID actually hit. And somebody was saying, well, if somebody chooses to work at home, then that's no responsibility. And the lawyer was quite clear, as if you are aware that somebody is working from home, you have the same duty of care if they choose to, or if you know that that's what they're doing. You can't just say, no, not my problem, they're choosing to do that. So I think we have a responsibility to manage what we're aware is going on. But we come back to the thing I've been saying all along. It depends what they are doing at home as to what we need to do to support them. I think it is my view. Can I interject, John? I know you said that was
Please
the
do.
last one. I've just noticed one that's right. I was talking about, is it all about equipment or is it about massage and exercise? And can I just say that it's not all about equipment. Work organization, breaks, stretches, movement. That we are humans, and no matter how good your workstation is at home, in the office, you've got to move, and encouraging people to be good to their bodies and exercise and move is absolutely key. And so thank you for putting that in there, because you reminded me, because we'd very much focused on those things, and actually encouraging people to look after the best tool they have has always got to be a good thing, hasn't it? Sorry, I couldn't let that one go, John.
No, it's a good one. No, I agree.
I'd also add to that. It's interesting from a mental health perspective that we're actually seeing an increase in loneliness now. That's not just in people who live alone. It's I suppose back to the example I gave of a younger person living with their parents who's maybe not coming into the office as much, so they're not interacting with colleagues. So that is also a thought for you as an organisation in terms of what can you do to, from a wellbeing perspective, to encourage the kind of the social element and the mental health aspects as well.
Fantastic. No, thank you. Great spot, Katharine. I agree. A very good point, and particularly a good point, I think, to conclude on. If we haven't got to your questions, I do apologise. We've run short of time, but thank you for all those questions that went in. That was exactly what we were looking for, to make this as inclusive as possible. But what I would encourage you to do is please feel free to reach out. You can see our details on the website there, where we will be happy to answer any of your questions, and we will look to come back to the questions that have been put into the post. And also, as I mentioned at the start, we will be looking to run many of these webinars, and the next one coming up in June around some innovative bit of technology in the X-ray glasses that I would strongly encourage you to sign up for. But in order to subscribe, if you just go to posturite.co.uk/subscribe, and we will look forward to seeing you on our next webinar. And a reminder that all the slides will be sent out to you following today. Thank you very much for your time today.
Thank you.
Thank you.